Hi, I'm Dr. Patricia Coughlin, and I wanted to talk to you today about how important it is to assess your patient thoroughly and carefully, rather than to assume you understand what's going on with them. I'm also going to talk about how important it is for us to keep abreast of the research. It's not enough for you to just focus on your clinical skills and to understand theory, but to check out your theoretical assumptions and your clinical experience with research, because research suggests that human beings are really bad at understanding others and predicting their behavior. We tend to be pretty egocentric. So we think that other people think and behave as we do. And we really, again, we overestimate how good we are at understanding other people and at predicting their behavior. A good example of this is if you think about, well, who's really good at this? We would think that like FBI profilers must be really good at understanding people and predicting their behavior. But research suggests that they are no better at it than all kinds of other groups. Like one research study found that chemistry majors in college actually did a somewhat better job at predicting behavior than the profilers. So, another interesting study was, which speaks to our overestimation, that 86% of psychologists actually thought that profiling was effective. So we're actually not very good at this, but we think we are. So how can we correct for this, right? Correct for our tendency to assume that we understand people with relatively little data to support that. Well, I think I've given you a hint right there. We have to obtain data and lots of it, right? So being, it turns out, very motivated. So being aware of this tendency that we have to overestimate our ability to be really motivated to understand people in depth and very specifically, and to keep an open and curious mind is your sort of guard against those cognitive biases, right? So keep an open mind, be curious, and really go after specific data. Don't assume you understand what the patient means by anxious or depressed. Really ask them specifically what they mean, how they experience it, what they're thinking and feeling, and in particular, what tends to trigger those kinds of feelings. Everybody is different, so you really want to understand the particular person sitting in front of you. So get that specific data and check it out, right? So it's their response, again, to your intervention that's going to give you the best data. So I often tell my trainees to try to be much more like Columbo than House, right? The know-it-all, right? So be really curious, really, and pick out maybe some inconsistencies and really ask questions like, well, who was that and when and how and that sort of thing, so you can really get a good sense of what's going on with this particular person. Another really interesting area of research involves our ability to read others non-verbally. So we know that human beings, most of our communication, the majority, is non-verbal. And yet again, we tend to overestimate how good we are at reading people's nonverbals. And I know in ISTDP, we pay a lot of attention to the body and to nonverbal cues, but there's a danger of over emphasizing this. In particular, things like sighs or clenched hands. We'll think, oh, the person's sighing, that means X, Y, and Z. Well, it turns out that if you just pay attention to nonverbals, and I know some people do a training in which they'll turn off the audio and just look at the patient's nonverbal. Now, That can be fine if you're trying to teach yourself to pay attention to those. But when we take out the verbal, our accuracy on understanding nonverbal cues plummets. It goes down by 54%. So you need both. You want to be listening to the content and watching the body, and be especially attentive to context. It makes a huge difference. And also, even though we tend to want to look at faces and put a lot of emphasis on those kinds of nonverbal communications, again, they're only accurate if you're looking at the whole body. And particularly when we're looking at intense emotions, the difference between joy and terror is indistinguishable if you're just looking at the face. So you have to look at the whole body, you have to listen to the content, and you have to be aware of the context. So the point I'm making to you is assess the patient, don't assume, keep open and curious, and gather your data. Don't make assumptions based on just one or two data points. This is a real cognitive bias that human beings have, and we think we're much better than we really are at understanding other human beings. So I hope this is helpful to you, and I look forward to your feedback. Bye-bye.